Good morning. This is Dr. Timothy Scott Beck here at LifePoint Medical. It's Monday morning, and I want to say hey to you and let you know we are up and running this morning. If you need something, we want to take care of you. So let's talk about some things going on and give you some clinical pearls. First of all, we talk about our annual wellness visits, okay, and how important they are. But one of the mainstays of the annual wellness visit is when we reconcile your cancer screening, okay? And that's when we go through and we look at you and your age and try to figure out what the appropriate screening test is for you when it comes to not just cancer, but a bunch of things. But the reason I want to talk about cancer is because I'm seeing we're just running through a cycle here where a lot of cancer is popping up. And I just want to remind people to get their annual wellness visits and get all the cancer screening that you should be done for your age at the appropriate time, okay? Because listen, the things that we have tagged, or the government has tagged as being useful, are the ones that actually have a preventive advantage. In other words, we don't screen for every cancer under the sun because you can't, but there's specific ones that we do, like breast cancer, we do mammograms, and for cervical cancer, we do pap smears, and for prostate cancer, we do look at your PSA. For GI or gut cancer, we look at your colonoscopy and stuff like that, okay? So just don't let it pass you by. Don't let that opportunity to prevent something from happening, don't let that be you, okay? And we're here to help you and coach you through that, okay? One of the screenings that we do during the annual wellness visit is called a AAA. And it's where we scan your aorta for an aneurysm, okay? And there's a specific time frame, like 65 to 75 is when we do this. And usually you have to have a history of smoking. I think it's males who had smoked over 100 cigarettes between the ages of 65 and 75. We check for these aortic aneurysms, and we find them. It's not uncommon for us to see one and for us to refer a patient to have it fixed or medically managed so they don't die from it. The reason we check is because aortic aneurysms is a common cause of sudden death, okay? And knowing about it and treating it is a surefire way to mitigate that risk for you. So that's another one of those things we do in your annual wellness visits. Okay, our weight loss shot program is going really good. We've got many subscribers to it, and they're doing really well. If you're interested, come in and talk to me, and we'll talk about what it is and how it can help you. It is we've come up with an affordable way to do it, and we're getting better at getting the drugs now. We had some problems getting the drugs, but that seems to be working itself out. So we know obesity is an issue, and we know a lot of people have to deal with it. We've got a way to do it, and it seems to be a very effective way to do it. Now, I will tell you, though, that it's not a matter of getting a shot and forgetting what you're doing. You've got to still use your brain, okay? And the brain, if you use your brain with the shot, is the most effective way to get your weight down and get you in a better position in life, okay? Chronic care management, I just want to remind everybody that this is a program that was designed by Medicare for us to help you. We've got quite a few people signed up for it, and it's going well, and we're doing exactly what we're supposed to do. Some people get mad or confused, and they don't understand, and that's the first thing they do is quit that, but they don't understand that's what we use to help them in the background with your medical care. And Medicare likes it. They've been paying more because it has shown to be very helpful in prevention and helping patients proactively. And that's what we do around here. We're trying to work on you and get to you before some of these crazy diseases get to you. Okay. Listen, thank you so much for listening to me today. I appreciate it. 706-782-0016 is our number. We try to do our best to see people in a timely fashion if you need help. Thank you so much for listening. Have a great week. Call us if you need us.